Probably one of the most common questions I get asked is, how do I figure out where to go, what to do when I need healthcare? So, for example, I might be here in Santiago de Compostela, which is a city in the northwest part of Spain. So those of you who are expats will be probably quite familiar with Google Maps. So often what I do is I go over here, and even though you might be in Spain, you can usually look for example, let's say you have a major bunion issue, you have a foot issue, you have a lot of pain, and you're trying to figure out what to do, who to go to, who's a good physician. You can just type it in English, nice and easy. You don't even have to say podiatrico, podologia. In Galicia here, they say podologia. If I do a search here, you can see that a bunch of little clinics come up. Now, one thing to understand when you do a search and you're trying to see if the reviews are actually legitimate or not is to take a look, right? So here we got 9 reviews, we got 26 reviews, 5, 17. Obviously the ones that have like a 4.2 star, maybe less likely for them to have any fake reviewers in there, but certainly possible. You might see somebody here with a very low review. Understand that as a patient, when you go to a physician, right, when you go to a clinician, they might have low reviews sometimes because somebody has a problem with their front desk person, somebody has a problem with their medical group, but the physician themselves might be good. So for example, if I click on this, I'm just picking a random one here, and if I go into the reseñas, which is the reviews for me, of course I could change the language here to a different one to make it easier for you guys. You can see, so I will ordenar means like, group it by order it from top to bottom, the most recent ones. That's usually what I like to do. I like to look at the most recent ones. And somebody might say like, hey, this is a very professional person. Now, if you install an extension on your Google Chrome for Google Translate, which is translate.google.com, it's a Chrome extension, then you can right click here and it'll give you an option to translate the entire page into English. Nice and easy. Most of you know that, some of you don't. And once you translate it, then all of a sudden you will see everything show up in Spanish, in your language, whatever your language is, usually English, and you can read through things better. And so somebody might say like, con muy mal humor, so somebody with a very bad attitude. So this obviously shows that the clinician probably is just not a great clinician, and this was only a year ago. But somebody else here, un gran profesional y muy buen trato. Good. So I was very well treated and very professional clinician. And that's the point. Like really read through the reviews. Now I may want to go down a little bit, take a look. Here's 35 reviews, Clínica Podosan. So it's, I can say, yeah, this is pretty close to me, and I can look at the reviews. And what I can do, again, I usually like to look at the most recent first. And I can see here this person already has 7 reviews, so this is probably not a fake account. This one has 19 reviews, probably not a fake account. 6 reviews, no reviews. 40 reviews, 64 reviews, 22 reviews. So these are people who have already put a lot of reviews on other sites, right? So they're probably not fake burner accounts, as the cool kids call it. So these are legitimate. But unfortunately, if you click on some other sites, let's just see if we can find one here. You might go to reseñas, to the reviews, you might go to the most recent ones, and you can see this one's actually good. 10 reviews, 4 reviews, but let's say they had no reviews or 1 review and no reviews, and it's already been a few years, their account's a few years old. So for example, this person has 4 reviews, and I can click on them, and I can see that they have a Spanish name, they have their face there. I can see that they wrote 1 review here, that's a 5-star. They wrote another 5-star review here, another one here, and they're all sort of in the same vicinity. So this is probably a legitimate person. You can actually look at where all the reviews are. It's mostly in Spain, right? If you found someone who has 1 review or 3 reviews and it's all over the country, and you could sometimes tell that it's a fake review. And that's a pretty good way of determining where to go and who to go to. That's number 1. Number 2, let's go back to the podiatry example. So I've zoomed out quite a bit. Let's go back in to my town. And if I find a website, let's say this, let's just go to this one. Let's see who comes up. So 26 reviews, and do they have a website? Why do I say that? Because if you have a website, chances are you're more accustomed to dealing with somebody who's an expat. If you're a very local company and business, you probably want to deal mostly with locals. So it may not be a good idea to go with someone like that, right? Because they don't have a website. You have to call them. It might be difficult to communicate with them. Now, this phone number might be a WhatsApp number. So one thing you can do is add this number, this name, and this number to your WhatsApp as a new contact and see if they come up. And that might be an easy way to communicate with them. Fix My Feet. Well, that's a pretty English name. So it's not only are they likely going to have a website, but well, this is actually not, I messed up. This is actually not in where I'm located. So let's, okay, I guess I can't do that. Santiago de Compostela. Let's go back to my town. Let's go to podiatry, podologia. And maybe I can click on Cepeda. And over here, that's the one that didn't have a website. I can go further down, look at somebody with a few more reviews. And this one says Federo Pereña. Nope, no website. Again, probably a little bit more local oriented. No website here. Go down. Here's a website. And it says, yeah, so there's some of the holiday hours, etc. If I click on them, it has a phone number. It doesn't have a WhatsApp. And sometimes WhatsApp is nice because you can just communicate with them a little bit easier. Everything's written in their local language, in Gallego. So that's sort of one of those things to, you know, like, do they speak Spanish, etc. For example, here, Servicio Contacto. It doesn't say anything about the clinician. I am personally reluctant to contact any group where the physician herself or himself is not on the website. And I can't read anything about them. I can't research them. So I'm not a fan of that, but that's a personal choice. Your mileage may vary, as they say. So if I go to Podosan, for example, I can take a look at, okay, so they don't have a website. I can go to Don Gago. Was that the one? Yep, that's the one that had a website. And then let's search some more. So I can look further down the list and I can take a look at this one, Maneiro. Okay, so that one's not loading, but let's say it loaded and I go on the website and there's some information about them. Great, that's a really good way to start that conversation. And probably one of the best things that you can do is actually just start a conversation. You know, if you're doing WhatsApp, you can leave voicemails, you can do text messages. If you're doing phone call, and you can communicate in that language. Hi, who's the doctor? How long have they been practicing? Are they comfortable taking care of bunions? Are they likely going to take me to surgery? You know, are they going to try some conservative stuff? So that's always a really good way to just start off that conversation. Now, a clinician who doesn't want to answer those questions, or their front desk who doesn't want to answer those questions, says, well, you just have to come in, you have to be seen. You have to decide, you know, is that the right clinician for you? For my own patients, when they contact me, and we always have a 15-minute free session, if they want to ask me a few questions, great, I'm going to ask it. I'm going to answer it based on my capabilities. And if I can address it with them, that's wonderful. So other things that I do, let's say I find Molinos and I go to, well, we got to find somebody who has a website, Maneiro. No, unfortunately, they're not loading. So one thing that I do is then, once I find the name of the clinician, so let's say Dr. Piñal de Oña or something. Let's say somebody's name is that, right? So then I want to go to their website or go to that country's doctor repository, and I want to just take a look at them. Like, here's a hand surgeon apparently, and Dr. Piñal, that's his actual website. Great. So let's just use this example. So it looks like that's multiple surgeons. They're in Madrid, so this is probably the main guy because he's there. And these are the different. Yep, these are all doctors. Great. And then let's see. Oh, perfect. So if I see Dr. Piñal here, I can read a lot about him. Looks like he did his website in English. That makes it even easier. There's a little video about him. Fabulous. It tells me everything I want to know. So I can research him. That makes me feel good, right? And there is some information on the website, you know, the locations that they're in, some news, some blog posts, languages. This is great. This is the kind of site that I love to see because I know that this person probably is comfortable dealing with someone like myself as an expat. And then I want to call them and see what they're about. Are they about just trying to, you know, order a bunch of tests, etc.? If that's the case, that may not be the best fit for me. Now, there is some other ways to gain some information about your medical condition, so bear with me as I do this with you. So Google has some chat options. So let's see. Okay, I'm still in. Let's do this. So we're gonna see if we can change the language just to make it a little bit easier. No, it doesn't let me change the language. Okay, so let's go to Google, and I may want to say, is bunion surgery necessary? So the reason I say this, right? If you typed in is an appendectomy necessary? Is removing my appendix necessary? Right? You're going to get some really good information. Now Google is going to give you some basic. You may need bunion surgery if you have severe foot pain that happens even when walking or wearing a foot comfortable shoes. So right off the bat, now me as a physician, I would disagree with this statement because it's not true. Even if you have severe foot pain, until we have controlled that foot pain, doesn't mean you need surgery. So a better statement might be, a person who fails all conservative treatments, and despite those treatments that they have followed, they still continue to have pain and they cannot walk, they cannot engage in their activities, the pain is causing suffering in their day-to-day life, that person might be a good candidate for surgical evaluation. Why am I using all these big words? And I'm saying this because obviously in my practice at Expat Health and in my digital nomad health coaching and clinical practice, I take my patients through these things step by step. Oh, perfect. That's what I was looking for. Change to English. And I want them to understand that like maybe surgery is an option, but are they a good surgical candidate? Some of my patients who are very emaciated, very thin, low muscle mass, or don't have a good diet or have diabetes are going to be terrible candidates for foot surgery because I've taken care of those patients. I'm not a foot surgeon, but I've taken care of a lot of patients who've had foot surgery. So it's a little bit more nuanced. Now, where's this article written? This is written by Johns Hopkins, bunion surgery. They want to push bunion surgery. They're not trying to keep you from going to Johns Hopkins podiatrists and getting that. What about the Bunion Institute? Majority of these are receiving funding from the Podiatry Society of America and other places where the information may not be very accurate. It doesn't mean they're wrong. It means you got to take everything with a grain of salt. Now, for some of you who are more comfortable with any kind of using some artificial intelligence stuff to get information, there are a lot of different types of platforms that you can engage in to ask questions. So bard.google.com is one, and you probably have heard of ChatGPT, which is simply, I think it's openai.chatgpt.com or something like that. If you search for it, it'll come up. It's just a website. The reason I don't want to log in because I'm using a secure browser here, but for myself, sometimes what I'll do, if I'm thinking like, whoa, I wonder if this tooth pain is an issue and I need to go in, I might be a physician, but I still want to ask that information to make sure I'm not missing anything. So you can actually type it in to this chatbot and you can gain some good information. For example, I have a fever and severe right lower quadrant abdominal pain. How likely is it that I have appendicitis? And so the answer might be, it's quite high. Or you may not have appendicitis, but the risk of letting it go might be an issue. Or, what's the review for this doctor? You can even ask those questions like, is there any information about this doctor? Is there any negative reviews about this particular clinic? Is there any, who are the best podiatrists in this city? So learn these skills because that is how search is being done these days and can give you wealth of information and make you feel a lot more confident. So we reviewed Google and how to look at some of these reviews to make sure they're safe and secure, how to go on a website and determine if somebody is able to communicate properly with you, if they have the right things on their website. Doesn't mean they're bad if they don't, but it just gives you that extra signal that maybe they're going to be okay. Now, you might also go to them and they're going to try to sell you the world and they're going to try to sell you every surgery. So there's all kinds, and that's another topic for another video, as they say. And you now learned about ChatGPT and Bard and other ways to have conversations about certain things that's a little bit more interactive. So hopefully that is helpful. If you guys have any questions, please leave some in the comments and I'll get back to you guys.